Good afternoon, everybody. Happy Monday. Glad to have all of you back with us today for Live with Lyda. So I'm going to begin today. I've got a few things to talk about today, and then of course I'm going to take your questions, but I'm going to begin by talking about the COVID-19 numbers. These numbers in the St. Louis region continue to be good. These numbers are yesterday. Hospitalized 241, 39 people on ventilators, 14 people admitted to the hospital. And so those continue to be good hospital numbers for the St. Louis region. And those numbers are for all the major hospital systems within the region. Now we do know, and I'm sure you all have been looking at the news, we know that there are areas of the country and even some areas of our own state that are seeing increases in both number of cases, primarily in number of cases. And, you know, this is probably attributable to a couple of things, one of which is more testing. Testing is way more available. And then secondly, just, you know, the more concentrated, the denser areas, like the city of St. Louis County, other major cities, those places got more cases earlier, and now it appears to be moving into more rural or semi-rural areas. So right here in the St. Louis area, our numbers remain good. We keep a daily watch on them, as you know, because as we continue to open up businesses a little bit more, then there is the possibility, in fact, maybe even the likelihood of increased transmission. And that's why got to wear our masks, got to socially distance. I heard a couple people over the weekend say something to the effect that, oh, well, everybody's forgotten about COVID, but that's something that we cannot do. I understand that maybe it's not quite as top of mind as it was a month or 2 months ago, but we've got to keep it top of mind. We've got to continue to wear masks. We've got to continue to have a small circle of people that we are around so that we don't increase the spread and more people get sicker. So that's an important message there. I will, from that, lead into the fact that today is the day that gyms, fitness centers, related activities can reopen. Maybe some of you have already been to the gym today and gotten your workout, but it's really important for you to socially distance and to wear masks, and certainly important for the folks who work at the gym, the employees, to wear masks. They are today limited to 25% capacity. They have to post signage, limit the number of lockers that can be used within locker rooms, and prevent usage of treadmills due to the increased possibility of spreading the respiratory illness. They are requiring employees and customers to wash and sanitize your hands. And the staff have to conduct regular cleaning every 2 hours. So those are just a few of the highlights of what's required for gyms opening today. Gyms and fitness centers, related entities, that is the last business group to be able to reopen on a limited basis. So with that, all businesses in the city of St. Louis are able to be open as of today with criteria. I know you all understand that. So that's COVID. Couple of things. One other thing somewhat COVID related. Right now at 2 o'clock, with the help of Fair St. Louis, we are distributing 10,000 masks to anyone who needs one at the Life Church International Church of God in Christ at 8500 Halls Ferry Road. And I think there's another location as well on Church. I may be incorrect about that, but you can find that online if you need a mask there. It's from 2 to 6 in the this afternoon. I'm not there because I'm here with you all, and I didn't want to rearrange this. So Judge Jimmy Edwards, Director of Public Safety, and I think Dr. Fred Eccles are both there this afternoon, and we'll post about that a little bit later. All right, last thing on my list before we go to your questions is really a congratulations. A landmark case today was decided by the U.S. Supreme Court that ruled that LGBTQIA workers are protected from job discrimination. Now, I would have thought that would have been done a long time ago, but that remained a question. And in the state of Missouri, we know that the protections were not there at the state level. In 2006, so what is that, almost 15 years ago now, the city of St. Louis banned LGBTQIA discrimination based on sexual orientation. And so the city has always led the way on that, but it's good today to be able to report that the Supreme Court has said that they have job protections, and frankly, we can't be this day, and we cannot be for discrimination of anyone. We all ought to have equal protections under the law. So that's a good little report to be able to make for today. Here we are on the 15th of June, right in the middle of Pride Month. So happy to see that decision by the Supreme Court. So, do we have any questions? What we do with these questions, just so you know, there are probably some questions that you've already typed online, but we also look at the questions that some of them were left over from last week, or people email us questions. So that's how we get these questions at the top of the hour. So Jacob, what do we have today?
Paul is watching, Mayor, and would like to know what the guidance is for outdoor events in the city.
Just any sort of outdoor event, maybe in a park, or the guidance is certainly to wear a mask, maintain 6 feet of distance, still have a small circle. So if you're going on a picnic or having an outdoor event, now beginning today also, the Parks Department will issue a permit for use of a park, say for a small outdoor concert, up to 250 people, but they still have to be socially distanced. So we're easing into that because we know that being outdoors is better than being indoors, but still better to have a smaller group.
Kristen is watching, Mayor, and has a question about businesses. Are businesses that are open to the public, are they required to have workers who interface with the public wear masks, such as an office or a store?
Yes, they are. Anybody who interfaces with the public, if it's a grocery store or if it's a retail store, offices, if you go up to a counter where they might meet the public, yes.
Other COVID-19 related questions. Should everyone in the city and the county just go ahead and get a test now so we know who is infected? That's an interesting question. I've gotten that question a number of times. Just because let's say everybody got tested today. Of course, that would be impossible. You know that. But let's say everybody got tested today. Well, that doesn't mean that somebody doesn't come up positive next week. So it's a little, we want to know who is positive so that you can, if you're the person who's positive, so that you can isolate yourself, self-quarantine, not be around other people, not expose them. We want to know it also so that we can contact trace your contacts, the people that are within your circle, so that we can quarantine them, so that if in fact they're coming down with it, they don't expose other people. But it would never be possible for everybody to be tested on the same day or even the same week. So if some people just want to know, they want to be tested because they just want to know, do I have COVID? From my own point of view, I think if you have any symptoms at all, if you have a slightly elevated fever, cold-like symptoms, then yes, get yourself tested for sure, because you want to either rule it in or rule it out. But otherwise, I think if you deal with the public a lot, you should be tested. But if you have a fairly small circle and you don't have any symptoms, you don't have to, there's no requirement that you be tested.
Brad has a question, Mayor, about gyms and masks and whether the city can make masks mandatory while at the gym, even though it may be sort of uncomfortable.
So the city has not made masks mandatory for people who are at the gym. There are some gyms who have required that masks be mandatory. I think, especially at a gym where everybody's breathing hard and sweating and all that, it would be a really good idea to maintain at least 6 feet, 10 feet, stay away from other folks, make sure you're wiping down all that equipment. But you know how it is. If you're at the gym and you're breathing really hard and you're exhaling all this, and if somebody there has COVID, well, that's going to be an issue.
A question about the curve and St. Louis's place on the curve, which is flattening, but cases continue to rise in Missouri. How can we know if it's still safe to keep bars and restaurants and other businesses open?
Well, in Missouri, some cases are continuing to rise. There's a lot of good information about this on the internet, on Twitter, frankly, and through the pandemic task force. The St. Louis region itself, our trend lines continue to go down. Our hospitalizations continue to go down. Today, what did I say? We were at 241. We were as high as about 775 6-8 weeks ago. And so we've done a good job here of tamping down the spread of COVID, but it is expanding in some other areas and in some other states. I'm sure you've seen that. I mean, it's all over the news that some states are experiencing some pretty big increases. So we're concerned about that. But in St. Louis, as long as you'll wear a mask, and I mean, I'm out and about too, and I see some places most people have on masks, other places I see not so many. It's really pretty important, and you kind of have to take the step yourself, one, to wear a mask, and two, if you're around a bunch of people who don't have on masks, maybe you should go back at a different time or go to a different place, and stay 6 feet apart.
Quite a few questions, Mayor, about the status of playgrounds in the city, including splash pads in Fox Park and the Tower Grove Park wading pool. When will they open?
I don't know the answer to that. We're gonna write that down. I'm gonna get the answer to that for you by Wednesday. Yeah, I don't know. I don't know the answer to that. We're trying to keep kids safe, and trying to work with parents. So I don't have the answer to that yet.
Tanya is watching, Mayor, and has a question about if you happen to know what total percentage of the city's population have been tested so far for COVID-19.
I don't have that right off the top of my head. I don't know if we can find that while we're, how many people in the city have been tested. Do you have that, Kyle?
I think it's like 23,000.
24,500.
Okay, let me look at all those. It's on our website, but I didn't look at it before I started talking to you today. So tests administered in the city, 24,476, of which 2,596 were positive. So just a little over 10%. Negative tests, 21,000. Let's see what else is on here. Yeah, so go to our website, St. Louis, stlouis-mo.gov, and click right on the home page, and you will find, you'll go right to this data. So the 10%, what we've been seeing lately, hand that computer back off, what we've been seeing lately is about 5% of the tests are coming back positive. But early on, when we were only testing people with symptoms and pretty severe symptoms, a higher percentage were positive, as you might expect. So right now, about 5% are coming back positive, but overall we've had 10% positive. So you asked what percentage of people that is. So 24,000, there are 300,000 people in the city. So 10% would be 30,000. So what are we at? About 8.5% of the people in the city have been tested.
A few questions about COVID-19 and some high-risk populations. Cheryl has a question about, do we know why so many COVID-19 cases and deaths have been attributed to nursing homes?
Well, we do, really. One, everybody living in close proximity. A lot of nursing homes, a lot of personal touching between caregivers and residents of the nursing home as they assist them with their daily activities. So if one person has it and doesn't know it, it spreads pretty easily. You know, eating together, sitting together, being in close proximity. And then, I mean, the last reason, of course, if you're in a nursing home, in all likelihood, you're pretty old, and or you have a lot of underlying health conditions. So it's a combination of the living situation and then being susceptible and having a bad outcome with that. So one of the things that Dr. Eccles has done, he's visited every nursing home in the city of St. Louis. We make sure that they have PPE, whether it's gloves, masks, gowns, the PPE that they need. We make sure that they understand about infection control, disinfecting, sanitizing. So we're working very closely with them to try to make sure that they don't have a bad result. But I think the why is there a bad result is because folks are older and folks have health problems. And why is there so much spread is just the close proximity, you know, so.
We have a question also about how detainees in the city's 2 jails are able to stay safe during COVID-19 and be socially distant.
So we've had that question before, so let me kind of just give you a little bit of background. Detainees at either CJC or at MSI are, first of all, when someone new comes into one of those facilities, they're quarantined for 14 days. So that it's not easily spread. If they happen to be positive, it's not easily spread through the population. Secondly, we don't allow visitors, and we haven't allowed visitors since the middle of March, maybe a little before that, so for almost 3 months. We provide other ways for detainees to talk to their family, to talk to their attorneys, but we don't allow in-person visits there. And it may be a little while before we allow that again. If you think about it, it's when you have a lot of people living in close proximity to one another, you really just can't risk introducing COVID into that sort of a situation. You've probably read that across the country there have been many facilities, jails, prisons, correctional facilities that have had significant incidents of COVID. Luckily, we have not, in part because of the precautions that we've taken over the last 3 months. So the other thing is that everybody does have their own space in the facility. So it is a group living situation, no doubt about it, but we try to prevent COVID from getting in there through quarantine and through visitors. And the other thing, and you may know this, early on, 3 months ago, the circuit attorney and the judges determined that there were a couple hundred people. I want to say the number was 243. I might be remembering that number a little bit off, but somewhere in that neighborhood of people who were released from jail, and as a result of COVID. And so those are decisions. Who stays in either CJC or MSI? Who's there are determinations made by attorneys and judges, not by the city of St. Louis. We don't actually have anything to say about who stays and who doesn't stay. So those are decisions made by the circuit attorney, defense attorneys, and judges who make that determination.
A couple of questions about the status of the eviction moratorium in the city of St. Louis and the CARES Act. So Dan's question is, Is the city going to allow evictions to happen before CARES Act money can be distributed, who will help people stay in their homes with things like rental assistance?
So we're working really hard right now to get the CARES Act funding passed through the Board of Aldermen. And tomorrow, I don't know what time tomorrow?
1 p.m.
1 o'clock. 1 o'clock tomorrow is another hearing on the CARES Act bill. And it's a lot of money and a lot of good programs are in that bill, so we're very hopeful that this will come out of the committee tomorrow at the Board of Aldermen, and then it'll still take probably 2 weeks to get it passed. But if we can get this passed by the end of June, which I certainly hope we can, and we should, there are a lot of good programs in it, most of which are humanitarian programs with rental assistance and that sort of thing. So we should be able to get that passed before evictions happen again in the city of St. Louis, which is sometime in July.
Do you have an update on sports leagues being able to have their events in outdoor parks? This is a question from Brett.
Baseball, soccer?
Sports leagues.
Sports leagues, Brett. We'll get you a specific answer for Wednesday.
So sports leagues and playgrounds.
Yeah. We have said that contact sports like soccer, football, rugby, trying to think, that you really should avoid those because of COVID, but that might be changing.
I think moving on to other topics, we have a writing question from Rachel, who wants to know that
Hi,
if the
Rachel.
city of St. Louis has any way to apply for a marriage license online, or if you can do it through the mail.
That's like 3 questions I don't know today. I don't know the answer to that, but let's give her the Recorder of Deeds number. Aha. Good. Call this number, Rachel. I guess you're getting married, huh? You hope to anyway. 622-3257. 622-3257 is the Recorder of Deeds office. That's where you get your marriage license. City Hall is open now, you know that. And so you can come into City Hall on the first floor to get your marriage license. So congratulations to you.
Okay. On KMOX this morning, you said there has been no increase in the police department's budget for the upcoming fiscal year. Can you provide a snapshot of what their budget does look like and what funding goes where in that department?
What funding goes where? I might have to get my piece of paper here. Let's see, what did I do with it? Hold on. There it is. I think this is it. This piece of paper is written in about a 4 font, so bear with me here. Total budget for this year's police department is $180 million. That's all sources of taxes, plus $38 million to their pension plan. So let's just talk about what goes to the police department, though. $180 million, and this is for 2021, so this would start July 1st, assuming the Board of Aldermen passes it. And last year it was $182. And the reason for the decrease is just the decreases in sales tax and some of the taxes that fund the police department. And what does it go to? So do I have on here there? No, most of it's personnel. You know that. I'm gonna look at this would be 2019. Let's see here. That's 160. 168. Here we go. Last year it was $127 million of the 182 that went to personnel. It also includes city marshals, it includes park rangers, it includes training. That's something that we can post a link to. Maybe the best place to post the link to is to the city's budget, which is on our website. And, you think about the police department, there's police cars in there, there's supplies, there's all the kinds of things that you need to run a police department. New radios are in this year that we're in now, 2020. Next year, starting July 1st, we will have body cameras in the police budget. It'll include body cameras as well as in-car cameras and uniforms to accommodate them, and data and some personnel in order for them to, you can't just have all this camera footage and not have any people to manage that data. So we'll have that in this next coming year. So most of it's personnel, though.
A question about the Civilian Oversight Board, if you have an update on the work that they're doing and how they might have been adding more accountability to police officers' behavior.
So the Civilian Oversight Board has been around for, 6, 7, 8 years maybe. They do have a website. They have a link on our website. They oversee, they are civilians who are appointed to that board. There's 7, I believe. And they oversee what the police department does in terms of any sort of police-involved shooting, use of force. That's where there has been a complaint made, and they oversee that once the investigation is done. Now, about 2 years ago, that Civilian Oversight Board used to not have subpoena power. But about 2 years ago, I signed a bill which gives the Civilian Oversight Board subpoena power so that if they need to do their own investigation or supplement the investigation done by the police department, they can do that through their subpoena power. Of course, they would ask you first, but if you don't want to, then they would have subpoena power. That was a pretty important change that was made a couple of years ago to the Civilian Oversight Board. So check it out online, and I think they are a very valuable civilian board.
Are you going to close the medium security institution?
I think I kind of answered that. Well, maybe I didn't answer that question. So, question is, am I going to close MSI? We'd like to only run one jail. We'd prefer that. But particularly and over the last 3 years or so, the number of people in jail has been very significantly reduced. Today, the number of people in jail is probably a little bit under 750. When I came into office, it was over 1,450. So the number of people in jail has been significantly reduced. Now, people are of different minds about that in terms of, does that contribute to the crime that we have? Some people would say it may, but other people would say, well, nobody should be in jail just because they can't pay bail. I would agree with that. If you can't pay $100 bail, well, that's, you shouldn't be in jail while you're awaiting trial. So right now we have about 100 people at MSI and 50 or 60 at CJC. At some point, I think we will be able to close MSI. But there are a couple of things. One, you can't overcrowd CJC. The people that are at CJC are there, the vast majority, even the federal detainees, the vast majority of those crimes have been committed in the city of St. Louis. So whether it is a state charge, which is everybody who's there has a state charge, or whether the charge has gone federal, as they say, those people have still primarily committed crimes or are alleged to have committed crimes. I should be careful about the way I say that. Alleged to have committed crimes because they are detainees. They are not convicted yet within the city of St. Louis. So right now, I wouldn't want to we really don't have room at CJC. I wouldn't want to take all 100 people at MSI and move them into CJC. We're in the middle of a pandemic. Secondly, you have to have room in any jail the national accreditation standards for correctional facilities say that you should have at least 15% vacancy. And they use that because there are people in correctional facilities, in jails, that need to be separated from one another. There are men and women who need to be separated. There are people who need to be separated because they might be in a medical room or bed. So it isn't as simple as just one bed equals one person, or 10 beds equal 10 people. There are folks that should be separated there. So right now, I think that's not on the table. But we'll get there, I think, at some point. But I think right today, we aren't there yet. We're close, but we're not there yet.
We have a good question from Debbie Mayer, who wants to know, she's watching and is asking, will you implement the 8 can't wait policy or guidelines that came out about 2 weeks ago? According to their website, the city of St. Louis has not implemented bans on chokeholds, requiring de-escalation, duty to intervene, or comprehensive reporting. Is this accurate information?
That website's not accurate. I looked at the website also, and I checked with our police department, and back in 2007, we banned chokeholds. We called them vascular neck restraint. I don't know the years on these other things. We do have a duty to intervene for our police officers. Give me the other 2. We have all 4 of these.
De-escalation.
We do a significant de-escalation training, and we say always should use de-escalation when possible.
And comprehensive reporting.
And comprehensive reporting. Yes, we do have all of those.
A couple of people.
And it's a good thing we do.
A couple of folks asking, is the city of St. Louis renewing its contract with the St. Louis Police Officers Association?
So this is the St. Louis Police Officers Association is the union that represents police officers. We are federally bound, I think, by the National Labor Relations Board to negotiate in good faith with that union and the other dozen or so unions that we have, whether it's electricians or plumbers or carpenters or any number of unions. And we are committed to negotiating in good faith. So we don't get to just wake up in one day and decide, oh, well, we're not going to negotiate with that union because we don't, and I get the emails, so because we don't like the person who that union has hired to represent them. So we don't have a say about who represents that union. That individual is hired by the union, the police officers who are in that union. The city of St. Louis doesn't get the opportunity to say who we will negotiate with and who we won't. So they are a qualified bargaining unit, and we're going to continue to bargain in good faith with them.
Aaron has a good question. Would like an update on the status of condensing the Board of Aldermen from 28 to 14, and how much money will that save?
So back in 2012, Aaron, the voters, it was November 2012, the voters of St. Louis voted to reduce the number of aldermen from 28 to 14. I was an alderman at that time, and I was in favor of that. That goes into effect after this next redistricting. So it really goes into effect in about 2023 because, we're going through the census right now and redrawing the boundaries of all districts, whether it's a ward or whether it's a congressional district. Redrawing those boundaries happens every 10 years after the census. So right now we're going through the census. This is a good time for me to put in a plug. If you have not filled out your census, please do so. A lot of our federal funding is dependent on our population. So if you're not counted, we don't get any funding on your behalf. So I digress. So right now, unless the voters change it, which I don't think will happen, but we'll see, the reduction in the size of the Board of Aldermen from 28 to 14 is still going into effect in about 3 years. 2.5 years, something like that. It could go back on the ballot, and there are some aldermen who would like to put it back on the ballot, to give voters a second vote on it. But it passed pretty overwhelmingly when it did pass back in 2012.
KD is watching, Mayor, and has a question about the status of city-owned and operated swimming pools and whether or not they're going to open this summer.
Katie, I don't think they're going to open this summer. I did talk about this on Friday a little bit. We don't have lifeguards. I have asked the Recreation Division to see if there's a way they can open them at all, our outdoor pools, because, you know, kids and adults, for that matter, need that outlet, the ability to go swimming. But right now, it doesn't look like that's going to happen. I do know that the Y, which the Y operates our Carondelet Recplex and also operates O'Fallon Park Recplex. And they told me a couple of weeks ago that they do not believe they're going to be able to open those pools because they don't have lifeguards either.
Okay, folks, time for a few more questions. We have 2 or 3 people asking about the status of visitor bans at high-risk population facilities like hospitals and senior care and nursing homes during the pandemic. Do you know the status of when those sorts of visitor bans for the public will be lifted?
I don't. Hospitals, I know, are still not allowing visitors. Nursing homes are not supposed to be allowing visitors for all the, very high-risk population in both of those. What was the third place?
Senior care, nursing, and hospitals.
Okay, kind of all the same. Yeah, I don't know when that will be lifted. I think you would want to be, even though it's very hard on folks, I think you'd want to be awfully careful about visitors in either of those situations.
We have a couple of folks asking, Mayor, if you could please comment on the newest petition drive regarding the airport, and if you're supporting that, and is it a good structure?
So it's interesting that you asked me that. I just got that petition today, and I have been out and about over the weekend, and I know that there are people out trying to collect signatures. It's not, our airport right now, it's not as good as it should be, but right this minute, we are just struggling to get traffic back. I don't know, I would say to all of you, have any of you taken a flight lately? Not very many people have. I think it was 5,000 out of St. Louis Airport yesterday, and in and out. So certainly, all kinds of air travel related hotels, convention centers have really been devastated by this COVID virus. And so I think right now, I know they're trying to put it, the petitioners are trying to put this on the ballot. And there were a lot of people that were opposed to the last effort to get proposals on someone else to operate the airport. They were opposed because it wasn't on the ballot. So I think these petitioners are hoping that that will placate those folks that wanted it on the ballot and it didn't go on the ballot. So right now, I think, my focus is on working with the airlines. The airlines are our partners at Lambert. They have a choice about where they fly to and where they put connecting flights and where they put new flights. And so I'm really working right now with the airlines in order to try to shore up that partnership with them.
Okay, maybe our last question. Mike is watching, Mayor, and wanted to know what your thoughts were on the social media contest, March Madness of Flags, that declared the city of St. Louis has the best municipal flag in America.
That's a good final question. I hope you all saw that. It's all over Facebook and Twitter. There, you've got it right there. Let's see it on yours. Can we?
Yeah.
Let's see. So the city of St. Louis flag. This was a national or international?
It might have been international.
Let's see if we can get this. So this is a little. There's the camera somewhere up there. Okay. So this, our city flag, we are the champions. There was a song about that long ago, for those of you who remember. Because our flag was voted the best flag in the world. Let's call it the world. I'm not sure if it was literally the world, but I think we've got a beautiful flag, and it's nice to have a little city pride around our flag. So thank you all. Some of you voted, I bet. Appreciate everybody being on today. Was that the last one?
That's it.
Thank you all. Now, Wednesday, I'm going to be probably not till 3:30 or so on Wednesday because we have a Board of Estimate and Apportionment meeting at 2 o'clock Wednesday. Got to do that. Sometimes they last 15 minutes, sometimes they last 2 hours. So when that's over, I'll come back and report to you on Wednesday afternoon. Thank you all. Appreciate you being here. Have a nice day.